How are you? I am very excited today to talk about the biological clock and how to beat the biological clock, how advanced maternal age. I think it's very important to learn to be empowered. Some of the times we can't control many things in life. Like COVID-19, we can't control. How do you prevent? So you wear gloves, you're doing mask. All this are very important for prevention. Basically want to talk to you a little bit about how this biological clock and how we conquer this and how do we win. So this is a very interesting building. I wanted to share with you about quantity versus quality. I know, I'm trying to do this as an analogy. Now, the building was built a long, long time ago, but it is a very endurable building. It has lots of marbles and material that built this place, that went through typhoons, flooding, anything like that. What I was trying to get at is, sometimes it's not about quantity. Sometimes it's always about quality. When IVF was first started, the idea at that moment is really all about a quantity. Then lots of FSH and medication was introduced into the market, so quantity becomes a big, big deal in this world of IVF. And pharmaceutical are powerful, right? It's a powerful business, and also talk about really focus on quantity and really shape the business of fertility in the last 20, 30 years. Most of my fellowship education and many of our tutor and teaching is on about how many eggs you can stimulate. And even of the markers that we have been focusing on in the history of mankind, when we talk about day 3 FSH, AMH, antral follicle count, is really on quantity. Not many studies have been done on quality, have a couple reasoning. Not that they don't want to do it, it's because it is hard to do studies on quality. So one, you don't have an indicator. FSH is easy, it's low, it's high, it's a number, it's easy to quantify. But with egg quality, it is very hard to know how good is an egg. How do we judge if an egg is good or bad? It's still a mystery to majority of the scientific world. So I would love to talk about egg quantity and quality. Why? Because as we get older, egg quantity and quality both drop. And that is the reality of life. That if a person who is an egg donor who come to my office and want to donate eggs, I usually can get between 10 to 20 eggs standard at the age in their 20s. As you age older into your 40s, the quantity drops. It can go down to maybe 4 follicles on each side. So if I stimulate you really hard stimulate, I may get about 8 or 9 eggs. So quantity does drop as the time as you go on to your biological clock, and the egg quantity at around 40 or 41 is usually is around ranging between antral follicle count of 3 to 7 follicles. So a patient with 40, 41, when they come and see me, I will see a lot of down regulation of number of eggs. So then I would say, hey, don't be sad. I know you're not going to get 20 or you're going to get 15. Let's focus on this 7 or let's focus on this 10. And that is where equality talks start to come in. Equality is every woman is different. Averagely, I always tell every patient, it's not about how many follicles you have on each ovary, because every month you're only going to produce 1 egg. So I'm going to use a general ratio of what we see in a woman who is producing 1 egg ovulate 1 time in a month, and a year they will ovulate about 12 times. And if you are 25, 8 to 9 majority of the months, you great eggs, and about 3 of the 12 months may be bad. So when the 25-year-old come to me, actually they don't come to me, but if they come to me, it's very rare for them to tell, oh, they've been trying for 6 months, they can't get pregnant. We do have that patients, obviously. That's why we have doctors and their patients. But it's very outlier in the scheme of things. They are not majority. So after they have these patients who come to me at around 35, now I start to see the increased number of patients who are a little bit older that come to me. And obviously, it's not as good as when they were younger, but it's about 6 good, 6 bad. So your girlfriends, when they have sex, maybe every other month, they say, oh, I didn't get pregnant for 4 months, but I got pregnant the 5th month. Because every other month, so eventually they will get pregnant. At 40 is about 8 bad, 4 good. So I would see more patients because they've been trying for 6 months or 7 months, and according to ASRM guidelines, after 6 months of trying, you will, if you still don't get pregnant, please come back to see Dr. Luke, and that can happen. And so at 7, 8 months, I see patients, but I got some lucky patients during COVID where they've been having time intercourse or sex at home and they got pregnant. So it can happen. It's just not all the time you will not get pregnant at 40 or 41. So don't give up at 40, 41. Some of my patients obviously are not people just having sex at 40, 41. They've been trying at so-and-so IVF center in New York City, so-and-so IVF center. They did 2 cycles there too, and now they come to me at 41 or 40. Yes, thank you for the challenge, guys. I know you guys love to challenge Dr. Luke, and those are the things where I have to rethink, look through the protocol. How can we outthink the previous doctors who are great doctors also, and how do we better the protocol and try to catch that egg to get you pregnant at Generation Eggs or under Dr. Luke's care. And that is really, really the most important topic. So, number one concept I tell patients, I'm not here trying to get more eggs than the previous doctor. So if the previous doctor get 10 eggs out, Dr. Luke is not going to say, oh, you got 10 eggs at so-and-so IVF center, so-and-so, let me get 15. I want to be better. No, you will never hear that from me. Once that happens, I will say, well, I'm going to focus on see if I can catch that egg quality. Then you'll hear Dr. Luke talk about myostimulation, maybe using different type of oral medication to stimulate your eggs. I may not even give you a precise protocol because I always say I need to understand your ovary on day 1, day 2, or day 3 of your cycle when you come to me because every month is different. And then I will also talk about, well, who are you? Are you only give me 1 egg? Are you going to give me 2 eggs? Some of you may have come on to Instagram Live already last week or 2 weeks ago when during the National Infertility Awareness Week, Dr. Luke talked to some of my older patients. Older as in not they're old, I meant patients who were my patients before, and they came back and they interviewed with me where we did what we call embryo banking. What that means is that we are trying to capture each month of its chances, and we are trying to see if. So basically the concept, let me recap one more time, is not the number of eggs we get in 1 month. So if I get a 15 egg in January, and then I only get 8 eggs in February, the 15 egg does not win the February 8 eggs or March 8 eggs. It's not my idea is that it's not the quantity that get to the good egg. It's the month that we try get to the good egg. I know. Then all of you are going to ask me, Doctor, which month? So I don't have to do IVF in January, February. I will just do it in March if you know that. I know. I wish I know. And yes, that is where this is the limit of my power, is which month we can get to a good egg. I'm trying to do lots of review and studies, and we are using this downtime the last month. We're gathering some data, which is number of egg to baby. And hopefully the abstract, and I will give you guys our new data, and we are submitting to ASRM, American Society of Reproductive Medicine, is number of egg to baby. Means that when you look back all your cycles, even in your IVF center during your, not just with Dr. Luke or elsewhere you've been trying to get pregnant, and you look at all your cycles, where the euploid come, the embryo, is never always coming from the time when you get the most eggs. It is true when you are younger. So if a patient who's 30 can give me 15 eggs, I do want eggs. And when you're 30, 31, yay, get more because I want to buy more lottery tickets to win the lottery. So that is the concept. And that has always been traditionally my training. Everyone trains the concept. But as you get older, that concept starts to change. And that is no longer the same concept. That's I know you guys like, Dr. Luke, is there any studies? What's the what? Yes, it will come. I just need time. Studies already been done by other doctors where they compare myostimulation and conventional stimulation on a cost analysis. But problem with those analysis is that they group everyone together. Means they group the patient who's 30, 40, 45, but that's not what I'm talking about. I'm talking about a certain group of patients where the biological clock is already running out with a less egg quantity and possibly less egg quality, and how do we beat the clock? And that is where the IVF comes in. Lots of patients would say, Dr. Luke, you talk about IVF. What about no IVF? I'm just having sex with my partner. We just got married at the age of 40. We met each other late. What are the other things we can do? Yes, you don't need to jump right to IVF. That is correct. You can just have sex, get the ovulation kit, which is very simple to use. But quite honestly, guys, women is very hard to miss ovulation. Most of you are highly empowered, educated, informed. And even watching me on this Instagram live, all of you, just you guys, your intelligence shock me, your wisdom always teach me a lot. As a doctor, I learn a lot from my patients, and I love it. I love to talk. I always share so much wisdom with you guys, and I love to hear the dynamic and listening with you guys. So what I'm trying to say is trust your instinct. You are timing it right, and keep on trying. And yes, now with the jobs and people changes of insurance, you may not financially can do IVF, but so what? Keep on trying. Make sure you don't have history of injury or any infection like STD or sexual transmitted disease and things like that. Your tube may be great. Your ovary is great. Uterus usually is great. Uterus usually good, but you can just get ultrasound simply by your OBGYN or by me, wherever it is, and just check it out and start having sex. And I have lots of patients, again, highly informed, empowered. They even come and see me before they have sex. That's fine. I love seeing patients, and I love doing all this education and talk. But try. Don't be scared because you're 40 and say, oh my God, I need IVF. That's not true. You can try on your own doing ovulation kit. And yes, eating healthy is important. We are doing a supplement and acupuncture session next week. So I can't wait to share with you guys. I know lots of patients ask me, Dr. Luke, do you have any herbs? Do you have any acupuncture suggestions? And we're going to talk a little bit more with acupuncture experts. I do love East and West combined thinking of medicine. I do love acupuncturist, like the philosophy about it. But most importantly, I don't prescribe, I don't want you to be stressed out because there's so many appointments and it can get very expensive when you see an acupuncturist. And the visit, obviously now with COVID, even it's not easy. So I always enforce is nutrition, healthy diet. I know it's kind of like blah blah, like all the doctors say the same thing. Ovarian reserve does have some research on a lower AMH and lower ovarian reserve when you are doing too much of the alcohol and smoking. But those are simple, guys. Smoking, alcohol, you don't need me to lecture you. And a glass of wine, of course, a glass of wine will be okay. Dr. Luke, one sip, I'm drunk. So I don't usually drink more than one sip. But I know some of you are good tolerance, better than me. A glass of wine will be fine. No binge drinking, obviously. So this is kind of common sense and really believe in your body and have sex, okay? Now, after 6 months of trying, and this is where the empowerment begins, not 2 years of trying, so when you're 40, don't try 2 years and find me. 1 year, 6 months is really the guidelines. You can do 5 or 4 months, doesn't matter. Have a telemedicine or talk to me, wherever it is. And basically to learn what the options out there. How much, what's the insurance plan? If you're looking for a new job, old job, what the insurance, how to take advantage of it, how to empower yourself, what kind of medication the insurance covers. Why is that important? Because time is ticking. So the insurance becomes very important for you to have tools to beat this biological clock. The quality of eggs is not going to change. I can't change you back to when you were 25. I can't change many things, but other things can change. Insurance plan, how to be smart about it to get to fully coverage, or how to look at your finance in terms of what's the plan. If you cannot pregnant in 6 months, what do you want to do after 6 months, or 1 year, or 2 years? Do you have hope at 41, 42? Those are great questions to ask. So if you are 40, 41, 42, yes, the answer is yes. This is the age to fight. Don't give up, because once you pass 43, 44, it is harder. I'm not saying 43, 44 if some of you are, oh, I'm going to give up. No, that's not true. I'm going to interview one of my lovely patient who got pregnant at 44, and now she's possibly coming back for a second baby. And so it's a long journey. It doesn't have to be absolutely no. But it is harder. So learning your equipment, learning what tools you have to fight this biological clock is my job. I'm your companion. It's my fertility friend jobs. The fertility friend is our clinical assistants at my office who are like me and been trained like me, and to help you guys to navigate through this. So basically, I went from IVF, natural. We talk about how to embark that journey if you want to have time intercourse. And yes, be aware who's your partner. At 40, you need a team member to make a baby. It's not just one person, it's just you, your partner who want to have a baby. And yes, we're going to have another session talk about mommies who are single moms who may not have the luxury, have a partner, and maybe have to do it alone, how they do it, and how do I help, how do they choose sperm. So those are very important to understand as you beat the biological clock. It's same as you're really trying at 30, 31, but because the time is ticking away, and because you only have this moment, you have to understand your tools, how to beat it. Same as, umbrella. You cannot change when the sky is raining, but you need a raincoat, you need an umbrella, you need to equip yourself, and you will still go out because it's raining, because you need to, go to grocery stores. Same thing with COVID-19. Some of you, as you may know, may be opening up the world, and how do we protect ourselves? Gloves, mask, all those things are very important as we're going on. So equip yourself. We'd love to hear about how to prepare your body for egg retrieval. Great question. During the 14 days before the egg retrieval, it is a little bit tough because you're getting all these injections in your system, and so it can feel bloated and not very uncomfortable. Basically, for medical advice, is no sex activity, stop running around about 1 week after you start medication. Okay, my friends, it was a pleasure seeing you. Talk to you later, and hope to see you on Friday at 1 p.m. Bye-bye.